Hi, I'm Mary, and I'd like to thank you first of all for giving me uh, a few minutes of your time so that I can talk to you about something that I'm very passionate about, and that is the opioid crisis that we're having in this country. The opioid crisis has affected almost everyone. If everybody just takes a second to close your eyes and think, do I know anybody that's been affected by this disease? Come on, everybody, just do it for a second. Could be a mother, could be a father, could be a son, daughter, an aunt. It could be the kid down the street. Okay, everybody open your eyes. This problem has spread everywhere. There's no one that is exempt from this. It happens to poor people, it happens to rich people, it happens to people who work, it happens to people who don't work, it happens to people who are sick, it happens to people that are well, it happens to whites, blacks, yellow. There is no person that this disease does not affect. And the opioid crisis is killing people in record numbers. And the information I want to give you today is information on if you see a suspected overdose, is there anything that you can do personally? And there is. I'm a registered nurse, and I think any person that is in the medical profession should either carry Narcan or have it in their car or in their home. I'm the type of person that if I see an accident, I will pull over. I will try to help the person. If I see somebody fall, I will go over and try to help. You may not be that person, then you probably don't need Narcan. But if you are that type of person that wants to help, then my advice would be to get a prescription of Narcan. Narcan's been around since I'm going to say it's in the 1960s, and it's been used intramuscularly and intravenously in the emergency rooms and hospital settings for years. But back in 1990, they started to see the opioid problem get worse. And so physicians started to look at a way to administer this that everybody would be able to use. So in 1996, Washington, D.C. and 15 other states went under a pilot study, and people were given take-home kits, Narcan kits, to use in case of a drug overdose. Now, in the state of Maryland, and every state is different, you can obtain a Narcan kit from any pharmacy. It is a prescription, but there's a standing order from all doctors that this kit can be given to anyone who asks for it. Now, I went to get this kit, and because I have insurance, they wanted to charge me $110 for it, which I was willing to pay because I think it's important. But if you don't have insurance, you can get this kit for as little as $1. And I think if you didn't have $1, the pharmacist would probably give it to you anyway. But it's important if you are a parent and you have a son or daughter who you suspect is using drugs, or if you are a spouse, or if you have someone on chronic pain medication at home, it's important to have this drug that you can access easily. This drug is very, very easy to use. It's an intranasal spray, and you can see how small it is. It fits in the palm of my hand. And you insert it in one nostril and push, and then you insert it in the second nostril and push, and the person should wake up. If the person is not experiencing an opioid overdose, don't worry, it won't affect them. There are no side effects to this drug. It will not affect you unless you have opioids in your system. And if you do, and that's the reason someone is giving this to you, this drug binds to the opioid receptors, and the person will wake up, they will start breathing normally, their heart rate will go to normal because it affects you. So the opioids can't affect the body. They no longer have that high. Now, some people may get angry about this. That's okay. It's also very important. This is not a solution to the problem. This only lasts 30 to 60 minutes. So if somebody's experiencing an overdose, it's very important to activate the emergency medical system. and so they can come and administer more life-saving measures. People may walk away, but you've done the best you could do. So if you are interested in this, please go to any government site, Google Narcan, opioid crisis, and they will give you information. Again, every state's regulations may be different, but in the state of Maryland, you can go to any pharmacy and obtain this drug for as little as $1. Anyway, thank you for your time, and I hope you never have to use this information.